The world was shocked to hear the cancer diagnosis of the Princess of Wales. In her update, Kate said she had to find the right way and the right time to tell her children, something that is not easy to do. With more on how to navigate these difficult conversations and what parents need to know, I'm joined by CTV's medical expert, Dr. Marla Shapiro. Good morning, Dr. Marla. Kate said it so well last week in that videotape message, and your heart could not help but break for her. How difficult are these conversations to have with children?
Yeah, you know, I can tell you personally from my own journey, I was in my 40s when I had my breast cancer, and my youngest was 9 and my oldest was in university. And I remember thinking that each of them need a different conversation. And the timing of the conversation when you feel ready to do this is going to depend on, you know, your approach. I know with me, and I think what I'm hearing from her is that I needed to have a plan. I needed to know what this was going to look like. I needed to have them away from the public eye, which is why she waited till the Easter break. Very protective, which I think most parents would be. And her children span the age gap of quite young to like mid-elementary school. And the way that you talk to your child is going to be child specific, but there's some general thoughts that we have in terms of age. And it sounds to me like she's thought a lot about this.
So how do you go about doing that? Let's start with the youngest age group.
Right. So the youngest typically would be preschool, because that's when you're going to have a conversation. Much younger than that, there's not much to have a conversation about. So really for them, it's about where is my mother? Where is my father? It's about separation, the fact that you may not be there, that there may be a change in their daily lives and their routines. And I think you want to try and keep their routine as much as possible. And you want to forewarn them and forearm them with some things that may change. For example, if there's going to be hair loss, that may be something that you want to talk about, even to the littlest ones. I remember my son, who was a little bit older than that, saying, oh, so when your hair grows back, it means the cancer would be gone. And I thought, what an interesting thought. Right. If we move up a little bit older now to kids who are, you know, beyond preschool and in kindergarten and early elementary, again, some of the things that we think about is, can I catch this? Because you can have a kid at school who's got strep throat and then you get strep throat. So is this infectious in nature without them really understanding? Again, the routine remains important. And I think you have to use clear and simple language. And often I will tell parents, why don't you ask, you know, what they think you're saying, get them to reflect it back. Don't think they've necessarily understood. So you may or may not use the word cancer. It may not mean anything to them, but you want to be ahead, particularly someone like hers in the public eye, and it's likely that the kids eventually will hear somebody talking about her. As kids get a little bit older, and now you're sort of looking at older than elementary, so through the elementary up to middle school, more likely to understand the concept of cancer. It's all over the news. They understand what cancer is. And for them, they may feel that they've got to shoulder more responsibility than you would think of, and they may begin to hide their feelings and be fearful about upsetting you, about telling you how they feel. Once you start getting kids who are now in high school, I think you can be more frank about the details. This is what my treatment is going to be, you know, look like. This is how I might feel. Not overwhelming information, but to be able to say, let's keep, you know, the doors of communication open. And if you have a question, ask me. I'll be as honest as I can and forthright, but come to me. Don't be afraid to talk to me or your dad, or talk to me and your mom, depending on who it is. And because I think that probably is the group that can have more of a conversation. And basically a teenager typically understands the significance of cancer. Certainly on social media, it's there all the time.
Yeah.
You know, stars who have cancer.
Yeah.
And they too may need a lot of reassurance, may need more information than you think because their preconceptions may be wrong. And they too may just hide their sadness and anger.
So this is a tough one, even for me to ask you,
Yeah.
but when a child, and I feel like children are smart.
They are smart.
If they say, Mommy, are you going to die?
Yeah.
How do you answer that?
Yeah, so, you know, I think I remember by the time I told my son that something was going on, he already knew something was going on. The dynamic in the house, he was able to tell that it was changing. When we put a name to it, it actually sort of was something familiar to him. And he did specifically ask about that question. I think children do. And I think that, you know, you reassure them that that's a question that most people ask. But the reason that I'm having this medication and the reason I'm having this therapy and the reason I may lose my hair or whatever it is because that's not where we're going. You know, we're going to be fighters. And I think you keep it in the present and you don't go towards the future. And you keep the doors of communication and let them know any questions they have. They shouldn't be afraid. They should come to you. And she sounds so well equipped and so on the pulse of who her children are in the way she's navigated this in the public, controlled the message, not let the message control her. So we wish her the best. And as she said, for anybody with cancer, and I think she was talking to her father-in-law as well as anyone else, don't give up hope.
Marla, thanks so much. Really
pleasure.
appreciate it.